Across India, people delay treatment, thinking spine pain always needs surgery. In this case study, Dr. Abhay Nene shows that non-surgical options can be just as effective.
So I'm just demonstrating this lady. This is an x-ray of a lady who's in the early 70s and she's had an active lifestyle. So if you can see from the x-ray, she's got a pretty worn out back. What they call spondylosis, what does that actually mean? So if you look at this picture, it's the side view of her back. So that's her tailbone, and these are bones that stack up towards the head. Now typically if you zoom in, you'll see that between the bones there are these spaces which contain discs which are like shape memory pillows, and they're the ones that give your back support and mobility. But if you notice, as you go down, these spaces have grossly reduced, which means that the disc there is worn out. Now this is called disc degeneration, in common parlance spondylosis, and that's the root cause of back pain among senior citizens and elderly people. So if you look at the front x-ray, you'll see that there's a bend that has developed in the back. So this is a very common condition, and typically the treatment here is rehabilitation. As you know, as we age, bones, tissues, ligaments, discs, they can't regenerate. So we have a limited supply of what can regenerate, and that's your muscle. So what we work on is supportive muscles, that is muscles in on the stomach side, muscles on the back, on the sides, which forms a kind of a chain around the weak link or the weak back, which is collapsing on loading, and that offloads the back and substitutes the springs that have gotten weak by having strong muscles to take the load off, and that's what keeps the pain away. So the typical treatment here is rehabilitation involving strengthening of muscles, addressing the weak bones, which is osteoporosis, which is again a rule, and modification in lifestyle where you use your back a little gently or use it in the correct manner so it doesn't bother you. So that's called spinal rehabilitation, which works beautifully for age-related degenerative spondylosis.